Yeah, good morning, dear colleagues. I'm very happy to show with you today recent results in brain connectivity change in Parkinson's disease when switching the treatment from levodopa to deep brain stimulation. The aim of the project, which I would like to share with you today, is a direct comparison between levodopa medication and deep brain stimulation of the subthalamic nucleus on functional brain connectivity in the same group of Parkinson's disease patients, examined before and after implanting the DBS electrodes. And we will do it with a so-called resting state fMRI. Previously, we showed already brain connectivity change separately with levodopa treatment in deep brain stimulation. And here you can see on the left side an increase of connectivity in terms of eigenvector centrality in cerebellar brain regions. On the right, you see brain connectivity change in terms of eigenvector centrality increase with deep brain stimulation. And interestingly, this we found in cortical brain regions, particularly in the left and right motor and premotor cortex. And now there is a question how these both things are related to each other. So how are the cerebellar findings in the levodopa project related to cortical regions, and how the findings with deep brain stimulation are related to cerebellar effects? And for that, we would like to answer the question, what happens in the brain, how brain connectivity is changing when switching the treatment from levodopa to STN-DBS. Okay, this we performed with a set of Parkinson's disease patients, quite young, with some history of levodopa, and we investigated these patients with the on and off levodopa state, and then the patients were implanted with DBS electrodes, externalized, and then they were put into the scanner, and there we measured resting state and did the clinical investigations with DBS. What is interesting here is that the clinical outcome is very similar with the levodopa on state and the DBS. You see it here. It's a similar clinical effect. However, due to the results which I showed you in the previous slides, we expect different patterns of brain connectivity with both treatment approaches. Resting state data are acquired with the 1.5 Tesla Siemens scanner, of course, because of the DBS electrodes. And we performed resting state, also other people call it task independent, because there is no resting brain, fMRI with open eyes. The parameters of image acquisition are quite standard with 1.5 Tesla. Interestingly here is that we had 5 runs. We scanned the patients in levodopa off and on, and with DBS in the left and right hemisphere unilaterally, also for safety regions. And then we performed the data analysis with eigenvector centrality, an approach with which developed by or established in the fMRI community by Lohmann et al. And what is eigenvector centrality? What is it measure of connectivity? And it's easy to explain to you, you will easily understand when I explain it to you with relationship to the airports. So you will agree with me that London Heathrow is a very important airport, so it would obtain a high eigenvector centrality value. So you see here with quite many connections. If you open a new flight connection to my hometown, which is a little town near Berlin, doesn't matter so much. So the eigenvector centrality, so importance of London Heathrow would not increase so much. So from, let's example, from 0.61 to 0.63. However, if you make a new flight correction to Frankfurt, which is the most important airport in Germany, then the importance of London Heathrow will increase a lot, of course. So the same we can apply to the brain to explain a change in brain connectivity in the terms of changing of major hubs in a network. And we would like to use this measure to observe the change of brain connectivity with the treatment, in our case, with the treatment switch from levodopa treatment to DBS in Parkinson's disease. And here you see the mathematical behind, so it's easy also from the mathematical point of view to compute eigenvector centrality. You just solve the eigenvalue equation, and as the Fokker-Planck theorem, also this equation, this eigenvector equation, has a unique solution if I exist, and because we exist, we can compute these values and produce results. And in our case, we found, when switching from levodopa to deep brain stimulation, we found an increase of brain connectivity in the left and right motor and premotor cortex. And you see it here in the upper row. It's very dominant. And we saw this increase with both unilateral left and right deep brain stimulation. What is important here is that this effect is not primarily driven by the surgery. So the surgery, of course, is a big event for the patient. So there is an electrode implanted in the brain. So it's a thing where, of course, a lot of things happens in the brain. And therefore, it's very important to observe also, to compare also both off states, which you see in the middle, and compute the interaction between both factors of treatment of treatment state and treatment method. So here is an interaction between the factor on-off and pre-post. And this interaction, the difference of difference, you see in the last row. And it was very interesting for us to observe that in the last row we see still this effect, which means our effect is not primarily driven by the pre-post, by the operation of the implanting of those. By the way, this off effect, which you see in the middle, is studied already in a very exciting study by Holliger et al. Stefan is also here. If you have questions, you can ask him. And there we found interesting connectivity change in the brainstem, but not in the cortical brain regions here, like in our case. And now, after we found out that we saw this increase when we do this treatment switch from levodopa to deep brain stimulation, we would like to know what are the regions which are now higher connected to this cortical brain regions. What are these regions? And for that, we performed a seed-based connectivity analysis. And with this seed-based connectivity analysis, which you see here, we performed exactly the same model as described before. We looked for the effect of the treatment switch, this on-on effect from levodopa to deep brain stimulation, and we looked for the interaction between both factors of treatment switch and treatment approach. So the on-off factor were investigated, the interaction between the on-off factor and the pre-post factor. And this interaction was very interesting. We found an increase of connectivity between our regions, which we found in the motor and premotor cortex, with cerebellar brain regions and with the thalamus. And this was very interesting because we found it both with left and right deep brain stimulation. So we put a seed in the left and right motor cortex. And here you see, you see it very nicely that in the last row you see that this effect is also surviving after computing the interaction between both factors. Yeah. To summarize, comparing the effects between levodopa treatment and STN-DBS using resting state fMRI shows an increased eigenvector centrality, that means an increased connectivity in the left and right motor and premotor cortex. And it shows an increased functional connectivity between this region, between the left and right motor cortex and cerebellar regions. And it shows an increased functional connectivities between the motor cortex and the thalamus. So in sum, we see an increased connectivity pattern in the whole corticothalamo-cerebellar network. Now, we found this interesting because we believe that our findings will help in the future, or might be very important in the future for the further development of DBS. And I thank our collaborators, particularly Robert Jesch and the Czech team, which did all the work for this wonderful project. And I kindly ask you for discussions to visit us at the poster 1001 for further discussion. Thank you very much.